So let's chat about this new experimental drug that's been creating a buzz. It actually helps restore tissue after a heart attack, as highlighted in Drug Target Review.
Yeah, that's pretty groundbreaking. So, what exactly is the drug doing?
Well, basically, it's designed to kickstart the tissue repair process post heart attack, by it's like triggering specific pathways that help regenerate damaged heart
Mm-hmm.
cells. It's a real shift from just managing symptoms.
Right, right. It's almost like instead of just patching things up, it's actually giving the heart a chance to rebuild.
Exactly. And that's what really caught everyone's attention. The review talks about how innovative this approach is. I mean, traditionally, treatments focus on preventing further damage, but here we're seeing an actual restoration of
Yeah.
tissue. It's a big leap.
So, do we know anything about the mechanism? How does it actually work?
It's fascinating. The drug apparently stimulates specific cellular pathways that are dormant in typical heart disease contexts. It encourages regeneration, kind of like waking up the
Right.
heart's natural repair crew.
That sounds almost too good to be true. Is there any skepticism about how reliable this is in real world scenarios?
Well, I mean, there's a bit of a debate. Some experts think that while the preliminary results are promising, we need more clinical data to ensure it's safe and effective on a larger scale. It's like when you first try a
Mm-hmm.
new recipe. You need a few tests before you bring it to a dinner party.
That's a fair point, and I guess that critique makes sense. You wouldn't want to fully rely on it until proven beyond doubt.
Absolutely. And that's the beauty of how our field operates: constant evaluation and refinement. What's really exciting is its potential to change the recovery trajectory for heart attack patients. Instead
Yeah.
of lifelong damage, this might give hope for actual healing.
And isn't that a bit of a paradigm shift? I mean, traditionally, it's about managing after effects. Now we're talking true tissue restoration.
Yes, it's like, moving from palliative care strategies to restorative medicine. This approach could drastically reduce long term complications, which is a huge win, a real
Mm-hmm.
game changer if the trials back it up.
I still have a thought, though. What about potential side effects? Sometimes these regenerative drugs might have unintended consequences on other tissues.
True, that's a valid concern. Researchers are treading carefully and they're monitoring off target effects closely. It's a balancing act between letting the heart heal and not triggering unwanted regeneration elsewhere. That
Yeah.
nuance is critical.
And I assume further studies, maybe even long term ones, are in the pipeline?
Definitely, long term follow ups are key. They need to confirm that the new tissue is both functional and durable over time. The early findings are promising, but there's more work ahead.
Right?
It's like building a house. The foundation must be rock solid.
It's really exciting to see such innovation in cardiac care. It sounds like it could redefine recovery plans for millions of patients.
Exactly. And while we maintain cautious optimism, it really shows how far medical science has come. The idea that you could restore tissue instead of just managing damage is so inspiring,
Mm-hmm.
truly fascinating stuff.
For sure. I can't wait to see the next round of data on this. It's definitely a topic to watch.